So on to the next question, which is, when is the right time to go see a dermatologist?
The sooner,
The better.
yes. Right at the beginning when the symptoms start, whether the texture, you start losing texture, whether it's sensitivity on a certain aspect of your scalp, whether it's flaking that just won't go away with simple washing, and the minute you start getting any forms of bumps into your scalp, it's time. You will need to see a dermatologist. So the sooner you identify the symptom, the better. Then you see a dermatologist. And have a diagnosis means, and then it's easier to treat and not lose hair. Yes.
Okay. All right. And for my last question is, what are the possible treatments that one can get? So this is after the diagnosis. What are the variety of treatments that one can get?
It's not an easy one to answer that one. Because, like I said, different types of hair loss calls for different types of treatment.
Okay.
So if you're losing volume or the texture of the hair, we need to find out why is that. Is there a nutritional issue?
Okay.
Hormonal issue?
Chronic medication?
Do you have a chronic disease that's causing that?
Yes.
So you identify all of that and treat accordingly. For example, you'll have someone who have heavy menses. I'm just giving an example. They lose a lot of blood, and as a result, they lose iron. When they lose iron, then their hair starts thinning. Okay. And for that patient, you need to involve gynae to sort out the bleeding.
Yes.
You need to sort out the iron that is depleted in the body.
So supplements.
Yes, but you need to have made a diagnosis, because you can't just supplement, everyone. And then you treat that, and then it restores the hair. And if you've been sick for too long, chronic condition, whatever it is, sometimes that condition needs to be managed for the hair to be restored. So you need to identify what the issue is. And then coming to scalp issues, patchy hair loss, it can mean a lot. Like it can be a lot of different conditions. There's alopecia areata, where you may just wake up and with a patch somewhere on the scalp. Usually that may be associated with other conditions. So when a patient like that comes in, sometimes we do certain blood tests, and then we treat either injections, either topical creams, either tablets, and sometimes we use even chemo-like type of medication to treat such conditions. So you understand? It varies from and then some come in, they've got bumps, scales on the scalp, there's bogey. It's a condition that you need to assess the level of inflammation and whatever else that's going on. So you do a biopsy, you send it, comes back, it tells you either it's this one, that one, that one. And if it's this one, then you need this type of medication. If it's this one, it's that type, whatever. And then obviously you need to work on the scalp, that things that you apply on the scalp to try to minimize inflammation, promote hair growth and things like that. Sometimes it's traction. People have been overstyling their hair, and sometimes it's not just that. Hair bands, ponytails, even Duke, just apply all wigs.
The other one that I saw was thinning of the corners with the gents, and specifically this one was caps. His hair was only thinning on the corners, and then I asked him why. It's like, I'm always wearing caps. I'm like, okay, let's take a break from the caps, because I feel like because the caps are always sitting in the one position, maybe your layer is causing your hair to reside because it was just on the corners.
traction can come in any form. So you overpull your hair, you wear something that's too
over,
tight, even wigs that we put on.
Because they sit on the hairline.
Yes, and this wigs being glued.
Oh
God. Yeah. So things like that. With traction, sometimes what you need to do is to stop.
Take a break.
Take a break.
Take a break.
Take a break.
Sure.
So it just depends on the type of hair loss. There are different types of treatment.
Okay.
But most of it will involve some of medication.
Yes.
Yeah.
Because I know the most common one will be traction. That I've seen a lot. Traction and then the postpartum shedding. Oh God. What's the treatment for that? Especially with my preggies, I always inform them, guys, your hairline is flourishing. After you give birth, please keep it in mind that it's not with every woman, but keep it in mind that there's what we call the postpartum shedding, and also the variety of time frame for your hair to come back. It varies with everyone. But it's until when it happens on that mommy and it's like, Smile, my hair's gone, but I did mention that it was going to happen. Yeah. How do we treat postpartum shedding? Or is it just like a natural?
It also, because of different things.
Yes.
Some, you find that, the changes in the hormones, and then eventually that will stabilize. Yes. And if you're breastfeeding, then it's a different route. If you're not, then it's and then you sometimes find that during childbirth, some people bleed a lot. Yes. And then with that they lose iron, they lose a lot of blood and then iron, and then so to get that back to normal. So it will just depend on how the mommy presents afterwards. Okay. And then you find those moms who go into postnatal depression, and then they now have to be on medication, and then so it just depends from mom to mom. Yes,
individual. Because also I've seen the time frame of hair coming back, it varies with everyone. Some people it comes back fully, some it doesn't. Some as it's about surviving, they get pregnant again, so it hits twice, and now it decides that it's not coming back anymore. So it varies with everyone. But I've seen that growth in terms of new mommies, and I'm like, okay, you need to be aware that this is what happens. But it varies with everyone, because some it's immediately after birth, some it's like 6 months after birth, some 3 months after birth. That's when they started seeing change in hair. Some their hair is gotten back, it's back. Some they don't go through it at all. Some it's hectic, like those patches are everywhere. Some it's just the front. It varies with everyone. But yeah, it's been one of the hair losses that we've seen
a lot,
growing a lot inside the salon. So yes, that was fruitful. I hope it is fruitful to everyone who's watching this, guys. I'm very much concerned. Like I'm very much invested in hair. I'm not just a hairstylist, but I want to learn more. I want to teach, because I've seen people falling onto the wrong hands, and sometimes it's the economy crippling us that we end up going to our other stylist, but I've seen how this is impacting everyone, especially for those that don't have much knowledge about how their hair is supposed to be treated, how it's supposed to look like. Where do I go once I start seeing these changes? I've seen a lot of that happening, and especially with our new customers as well, when they bring their own problems, like, oh no, I was never told about this before. Why is it important? I'm all about trying to break down that chain that, guys, your hair is not just your hair. There's that saying that hair is just hair, it will grow back. Oh no, sometimes it can pack its back and go to Thailand and go chill there and never come back.
How I wish there were more stylists like you who have such an interest in hair and not be afraid to send patients to the right people for diagnosis, for management. So I really hope with your passion for teaching, you're going to teach more people to identify these problems. Because the sooner we identify them, the better. The better for everyone. Because then when the hair loss is too extensive, say no, you can't style your hair anymore. So it affects your business indirectly.
It even affects the confidence of the person now, telling them that, oh, hey, you can't do these hairstyles because now you decided.
Exactly.
So
please keep doing what you're doing.
Thank you.
And and thank you for all the patients that you're sending our way. And it's so nice when you hear the patients will say, oh, Sma sent me. You know, I've been suffering from this for a long time, but I didn't know I needed to see a dermatologist. So keep up the good work.
Thank you.
Thank you. All the best with all the teaching and everything else that you're doing.
Thank you so much. Thank you much. And thank you for making time for me and my camera. Because you guys at home matters. But thank you so much. Thank you so much. I wanted him. I was boiling on it. I need to see somebody. I need to sit down with somebody. They must tell me what are the things that needs to happen, because I feel like just being at the salon, you understand in the salon level of answering to questions, but now we need to go out. We need to understand on the dermatologist level. You know, okay, no, now we must start fixing. You know, and thank you so much.